March of every year is dedicated to Colon Cancer Awareness Month. Colon cancer, unfortunately, is the second leading cause of cancer death in the United States. But it should be, and it is, the most preventable cancer that's out there. And the best way, the number one way to prevent colon cancer is to find a precancerous polyp and remove it before it becomes cancer. In today's video, I want to go into depth about colon cancer polyps. We'll discuss exactly what is a polyp. We will review the symptoms of a polyp. You may be surprised by this. And I'll give you 4 ways that I recommend to prevent these polyps so that you and your loved one don't become a statistic and develop colon cancer. Guys, let's talk about it. Howdy y'all, Dr. Islam here, aka your poop guru. I'm a trained gastroenterologist who trained at the Mayo Clinic, trying to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter where you can get the best tips and tricks like you're learning in today's video. So what exactly is a polyp? A colon polyp is a cluster of cells that form on the lining of the colon. And over time, these polyps grow and grow and grow until it actually becomes a growth in that colon. And it's that continual growth over time that doesn't stop that eventually does lead to a colon cancer. And in fact, we know that colon cancer starts from a colon polyp or a precancerous growth. So our goal is to find these polyps before they become cancer, remove them so you can minimize or eliminate your risk for developing colon cancer. Now, anyone can develop polyps, and this is scary, but we do know that there are some risk factors for you to develop colon polyp. Number 1 is age. So the older that you are, the higher chance it's going to be for you to develop a polyp. However, number 2 is also family history. We know that if you have a family history of colon cancer or colon polyps, you're increasing your risk for developing colon cancer and colon polyps as well. Other risk factors include obesity, diet, smoking, but some people, unfortunately, can develop colon cancer and colon polyps without any of these. And this is one of the reasons why we changed the screening guidelines from 45 to 50 years old, so that if you're 50 and you've not had your colonoscopy done, you need to get that done. So what are the symptoms of a colon polyp? Well, the most common symptom is nothing. I know it's scary. And this is the scary thing about colon cancer, is that these colon polyps, which have the potential to go into colon cancer, don't present with any symptoms. In fact, right now, you could be having a growth in your colon called a colon polyp that is not causing any symptoms. And this is why getting a colonoscopy is an important test, because we find these polyps before they become cancer. When you're feeling good, that's when we want to find these polyps to remove them so they don't have the chance of developing colon cancer. However, there are a subset of polyps that can cause symptoms. This includes rectal bleeding. Rectal bleeding is never normal. Don't ignore this. Don't blow it off. Don't just assume it's a hemorrhoid, because it makes an ass out of you and me. If you're having bleeding, it could be a sign of something bad going on. Get checked out, get a colonoscopy. Number 2, if you have a change in your stool caliber, the way it looks, the size, the shape, if it's changed, if it's different, and you don't understand why, this could also be a sign of a colon polyp growing inside that colon. Get that checked out. Number 3, a change in bowel habits. All of a sudden you become constipated for no reason why, or all of a sudden you're having diarrhea for no reason why. If you have a new change in your bowel habits and it's unexplainable, make sure you get a colonoscopy to find out exactly what is going on. Next is anemia, specifically iron deficiency anemia. These polyps sometimes can bleed, and this blood you may not actually see in the colon itself. It may be microscopic blood that you can't see. If your doctor tells you, you're anemic, in fact your iron is low, don't ignore that. Get a colonoscopy to find out exactly what is going on. So what are the 4 things that I recommend that you can do today to prevent your colon from becoming a cancerous colon? Here are my steps. Number 1, get regular exercise. We know that obesity is a risk factor for developing colon cancer and colon polyps. We also know that obesity is a risk factor to developing all sorts of gut issues. Getting exercise has been shown to help decrease weight, but more importantly, the exercise itself has been shown to have anti-inflammatory effects on your colon to decrease your risk of developing colon cancer. Get your exercise, get walking, start doing it now. Number 2, eat more fiber. Fiber is fantastic. It is the foundation for gut health, And fiber actually helps prevent colon cancer. We're seeing studies after studies suggesting that a diet that's high in fiber is protective for your gut, can help decrease your risk of developing colon polyps, and to decrease your risk of developing colon cancer. Number 3, decrease the amount of meats in your diet. I know this is hard. Trust me, I live in Texas. We eat meat all the time. I tell my patients all the time. Studies after studies after studies does suggest that a diet that's high in meat, red meat, or pork increases your risk of developing colon cancer. Try to minimize that and try to decrease the amount of meat in your diet. Then lastly, you know this, get your colonoscopy. There's no doubt from every single GI doctor in the world that a colonoscopy is the best way to find a polyp, get rid of it, and to decrease or eliminate the risk of developing cancer. Don't be scared. It is worse to have colon cancer than to get a colonoscopy. I know the prep is not great. I know it's not fun to take off time from work, but it beats the alternative than getting cancer. Get your colonoscopy done. If you have not done it and you're 45, you need to get it done. If you have symptoms, get it done earlier. Or if you have a family history, you may need to get it done earlier as well. So here's my call to action to you. If you're 45 and above and you've not called someone like me to get your colonoscopy, you know what you're doing. Ring, ring, ring. Hey, Dr. Islam, I need to get my scope. Oh yeah, we'll get you in. Call your GI doctor, get your colonoscopy, save your life. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter, where you can get great tips and tricks like you're learning in today's video. Thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.